Hello, welcome back. This is Saima. I'm a nurse from Southeast England. I'm going to share with you some useful tips. In this video, someone asked me 2 or 3 questions and they are really important. You need to know as a nurse, you need to know these things. As a healthcare support worker, yes, you need to know these things. So, all right, we are going to start the video. If you haven't met me before, I provide information about UK nursing, process of becoming a nurse here in the UK, what's happening, immigration updates, new jobs for nurses and healthcare support workers, any updates from the immigration. So each and everything we discuss on this channel. If you haven't subscribed, you can do so, and if you are a returning viewer, I'm here because of you guys. Thank you so much. All right, so someone asked me, Emma, she asked me, it seems very simple question, but as a healthcare support worker or as a nurse, you need to know this, and it's your responsibility to do it properly and to handle the situation properly. So the question was, if I see medicine on the patient bedside, what should I do? So it's what should you do if you see medicine on the patient bedside? I will give you the correct answer, and I'll also give you the practical answer. Yes, it happens all the time. So theoretically it's totally different and practically it's totally different, isn't it? Do you agree with me? Let me know in the comment section. If I see medicine on the patient bedside, my first response would be to should I tell you? So what we do, tell me. I will just take it, and then I will show it to my nurse who is with me, and I will report it to my supervisor or my manager, and I need to detex it. Yes, you're going to take the picture of that tablet, and you are going to detex it, means you are going to report it. So first of all, you saw the tablet on the patient bedside. All right, you are not going to tell the patient that there is a tablet for you, you happy to take it. No, please don't do that. All right, the second thing is, you are going to tell your nurse on duty who's with you, just tell her that there is a tablet on the patient's bedside. The third thing is, if the nurse is not available, you can report it to your supervisor. Just tell that I saw the tablet on the patient bedside. Or if you are competent enough, you can do the DATEX. You can report it online. DATEX, what is DATEX? DATEX is a system, online reporting system. That system is generated by the NHS organization, that we need to learn from it. We need to learn from our mistakes. If something bad happens or if something goes wrong, we need to report it online. If there is a fall, if there is any anything went wrong, like if someone got a needle prick injury or needle stick injury, or if there is a fall, if there is something, the crash trolley was open, or treatment rooms door was open, or something like that, we need to report it. Okay, or if there is any adverse reaction, or if I gave a medicine to a wrong patient, or if I gave a wrong tablet. So there are so many examples. All right, so we need to learn from these mistakes. What is the correct way of doing that is, we report it online. We report it on DATEX. That system is called DATEX. So we DATEX it. If you are a healthcare worker and you know how to DATEX it, it is your responsibility to do it. Okay, if you don't know how to do it, you can tell your nurse there is a tablet on the patient bedside. So if the tablet is from her shift, she is not going to give that tablet to the patient. She's just going to discard it right away in the yellow bin. All right, after that, her next step should be, she should DATEX it and report it to the manager also. If she is not sure where this tablet came from, she can report it, and she can also highlight it in the handover room that there was a tablet lying on the patient bedside. So to be honest, you as a nurse, it is your responsibility to stay there with the patient until patient to take all his or her medications. So let's say I'm giving 2 tablets to the patient. It is my responsibility to stay with the patient until patient swallow the tablets. Yes, you heard me right. You need to wait for the patient to swallow all the tablets. Give them a sip of water to to take them to chuck the tablets in. All right, but if you left the patient with the tablet and patient doesn't have capacity, or patient has dementia or any underlying condition, they may throw it out, or they may take it out, or they may whatever they want to do with the tablet, they can do it. So basically you should be there watching the patient taking the tablets. All right, you need to watch the patient to swallow all the tablets. When the patient swallow all of their tablets, you can leave the patient. A lot of healthcare support workers, what they would do is, if they see any tablet on the floor or on the patient bedside, they would just discard it. But it is not correct way of doing that. It's not right. You need to report it to the nurse who can detect it. If you are confident enough, you need to detect this. So why we need to tell the nurse? Because the nurse would check if that tablets are from her shift, and what are those tablets. If maybe it's very important tablet and patient didn't swallow or patient didn't take, they may need to give that tablet to the patient again, or she may need to inform the doctors that patient didn't take this tablet, can I give that tablet again, or whatever the case may be. The nurse and doctor, they can decide, and if and she can do the detox as well. All right, so if you are competent enough, you can tell your nurse, and then she says, okay, can you please detox it, and you can do the detox. All right, let me tell you that a lot of people, a lot of nurses, they don't like it if someone reports to the manager that there was a tablet on the floor or on the patient bedside and the nurse didn't know it, and I did text it. And a lot of nurses, they don't like it. But to be honest, you as a nurse, you should give the tablet to the patient before you leave the patient. I mean, wait for the patient to swallow the tablet before you leave the patient. So if you do that, you will not see any tablet on the floor or on the patient bedside. So I would say to the all of you, all of the new nurses, please be very careful and in giving the medication to the patient, because a lot of time those medications, most of the times, they are very important, and most of the time their behavior, their condition depends on those tablets only. So make sure you give them those tablets, make sure they swallow the tablets before you leave them. All right, and also you can be in trouble if the relatives, they see the tablets on the floor or on the bed, they can make a complaint about it, and also they can report to NMC, and NMC can remove you from the register as well, from NMC register as well. So be very sure, it's your responsibility as a nurse to give the tablets to the patient. So whatever you're doing, do it properly. If you're going to do the medicines, do them properly, let them swallow the tablet before you leave them. All right, so as a healthcare support worker, you can report it or you can detox it.